A new bill is being proposed in the Ohio House that creates new protocols for healthcare professionals when they believe a patient might be facing domestic violence. Co-sponsor of that bill, Representative Lauren McNally, joins me here now. Lauren, can you explain what the bill is aiming to do?
Yeah, so the bill is really going to help not just people of domestic violence, but also it can help child abuse victims. It can help human trafficking victims. But the idea is that it's going to standardize how healthcare professionals can provide help, how people who have been through this can get help, and make sure that nobody falls through the cracks.
And why would you say healthcare facilities are at the forefront? Are these places where these issues can be noticed?
Right, and that absolutely, that is one of the main things. So we're going to aim to make sure that our healthcare professionals can recognize situations and can provide opportunities or safe spaces for victims to get out of their situations when they come forward and are seeking medical help.
What other domestic violence laws are in place right now that give victims a way to get help? When you look at the state law, what is working and what maybe needs bumped up?
Oh, I think that we clearly have a huge gap in the way that we help domestic violence survivors, because we have seen a massive increase over the last decade in domestic violence, and we are just in 2024, we had the highest number that we've ever had in terms of domestic violence abuse. And so we are not providing opportunities and safe spaces for people who have been through this to come forward, get help, get out of their situations. And so we need to make some serious drastic changes along these lines.
And I know we've reported on it recently here on 21 News, but also can you talk a little more about how domestic violence is impacting the Mahoning Valley right now?
Yeah, I mean, just last year we had 450 cases in Mahoning County, and that's about a 37% spike in domestic violence. I'm sorry, that's actually a 37% spike we've also had in fatalities on domestic violence. So 450 cases, 37% of those end in fatalities. And this year alone, that's a huge spike. We have had, we've lost 157 people in the last year in Mahoning County to domestic violence. And the number one killer in this situation is from a gun. And so we need to really look at our gun laws as well if we want to hit this from all angles.
How much support do you think you have on this in the House, and if it makes it to the floor for a vote?
Yeah, it's really encouraging to see that it's a bipartisan bill. So we have Republicans and Democrats on it, and we have two people leading the charge who have been in the State House for some time and who have who have had leadership roles. And so I'm hopeful that this makes it all the way through in a quick manner, actually.
And if viewers want to help you get this bill passed, how do they do that? Is there any way that viewers can get involved?
Yeah, the best thing to do is to email or call the chairman of the committee that this bill is sitting in and ask for hearings on the bill.
Lauren, thank you so much for joining me as we look at, some of the stats. Like you said, a staggering number this year of an increase in deaths, and, just the numbers are troubling. Thank you so much for joining us here at 5.
Yeah, no, thank you for covering this issue.